NIV must be explained clearly to the patient, as the interface can be frightening and uncomfortable, and the machine is loud. You must also consider the risk of contamination and mucosal or conjunctival splash injuries when caring for a patient being treated with NIV, and use the correct personal protective equipment. Depending on the patient's diagnosis, you should consider the level of infection control precautions needed. Connect the machine to the oxygen outlet and plug into electricity. Essential equipment required is the disposable BiPAP circuit, including all tubing and a suitable interface, such as an oronasal mask or full face mask. The size of the interface is written on the packaging. Sizing of the interface is very important to ensure a good seal and will help patients tolerate the interface more easily. If the patient has false teeth, it is recommended to keep them in place, as this will create a more optimal seal. Each setup must have an exhalation port, either in the interface itself or as an attachment to the tubing. Ensure that the exhalation port is not blocked, otherwise CO2 cannot escape. Connect the breathing circuit to the machine and turn it on. Reassure the patient about the noises and flow of the device. The following information applies to the V60 model. If CPAP NIV is prescribed, go to Modes, then select CPAP. Set the CPAP and FiO2 levels. If bi-level NIV is prescribed, go to Modes, then select ST, which stands for Spontaneous Timed. Enter the prescribed IPAP and EPAP settings and FiO2 level. This mode has a default lower respiratory rate of 4. However, if the patient is not breathing spontaneously, then NIV therapy is not the appropriate treatment. The patient should remain in your line of sight whilst on NIV therapy at all times. If the patient's condition allows, let them feel the pressure of the airflow on the face without the interface straps on to begin with. Demonstrate to the patient the Velcro straps and the quick-release hook, teaching the patient how to remove the interface quickly if they feel they may vomit. Pressure injury, secondary to the interface, is a risk. A dressing can be applied to reduce this risk, for example, a silicone dressing across the bridge of the nose. Once the patient is ready, commence fitting the interface straps. Ensure the headgear straps are parallel and the headgear is fully extended and flat across the back of the head. The headgear is adjusted by using Velcro tabs. The interface should be snug, but not tight. You may need to stay next to the patient when first commencing therapy and provide regular reassurance. If the patient is uncomfortable, it may be necessary to start at lower pressures and gentle flow rates until therapy is tolerated. This may allow IPAP and EPAP targets to be reached while maintaining compliance. It is important to get a good seal around the oronasal mask for both optimal therapy and patient comfort. A leak can cause discomfort to the patient and cause their eyes to become dry and/or sore. You may need to reposition the mask, confirm correct sizing, or perhaps use the full face mask as an alternative. The V60 has a leak function. This senses the amount of air escaping and compensates for leakage around the interface to ensure preset pressures are maintained. Response to NIV therapy needs to be continuously monitored. Nurses can assess response in several ways, including respiratory rate, work of breathing, oxygen saturations, and heart rate. If your patient is not improving, escalate according to the instructions in their management plan or according to your local SIRS response system. Arterial blood gases are the optimal way to assess response to treatment and guide required changes to machine settings. Continuous monitoring and frequent documentation of vital signs is required on all patients receiving NIV therapy. Patient care includes regular oral hygiene and pressure area checks. These should be coordinated to be completed together to reduce interruptions in therapy. All patients receiving NIV are to have a formal assessment and documentation of full body skin integrity at least daily. This includes the skin under the interface, that is, nose, face, and neck.